Hi there, everyone. My name is Allie Virtue. I am a functional medicine nutritionist and owner of Parkside Nutrition. Today, for Kicking Cancer, I will be talking about general healthy habits, but especially pooping every day. So Baron reached out to me and I can't remember what he said, but basically he saw like a poop emoji and he thought of me. And I was like, wonderful. So first of all, I would like to share a little context as far as the poop emoji, the hashtag poop every day that is often all over my social media. Yes, I do like gut health, but that story originated when I worked at a clinic. And basically this woman said she was completely healthy despite all of these diagnoses that she has received. And when I asked her how many times a day do you poop, she said, oh, not every day, couple times a week max. And no one had ever told her that that's, potentially abnormal and not terribly healthy for your colon. So here I am today saying hashtag poop every day and talking about colon health, gut health as much as I can, and whoever will listen to me. Today, because Kicking Cancer is obviously a nonprofit supporting those who are going through cancer. So today I really want to talk about things that can really help you prevent or lower your risk of developing cancer or the reoccurrence of cancer and what the research says about that. In this recording, we are going to cover the top things that are going to help you with prevention of cancer, and we're especially going to tie in a little bit of gut health since we got this guy hanging out in the background here. So first of all, we can't talk about anything as far as preventative medicine or health in general without talking about sleep. So highly recommend you prioritize your sleep, and that's at least 8 to 9 hours. And please prioritize those sleep hygiene habits so you are winding down properly at night. That would be really helpful for improving your quality of sleep as well. Physical activity. Everybody knows we should exercise. Everybody knows we should probably go for walks, but I was really interested, because I use this a lot in my practice, is those daily step count. I looked at a study. It was a meta-analysis, so it looked at many other studies and combined the data, and it was really interesting because you had two different answers based on your age. The lower mortality was seen in people over 60 years of age that had at least 6,000 to 8,000 steps per day. Now, if you had over that, the mortality risk or the decrease in risk of mortality kind of plateaued after that. And then for people under 60 years old, their recommended dose of steps, you could say, was at least 8,000 to 10,000 steps. So it was pretty close to that general recommendation. So I thought that was really interesting that you had a lower rate of mortality, all-cause mortality, at those specific recommendations. Eliminating alcohol. If you could do one thing to lower your risk of developing cancer, eliminating alcohol would be an excellent one to choose. And I find this really interesting. So I want to use this visual. This is Canada's Guide on Alcohol and Health, a final report. And this came out at the beginning of this year, 2023. So if we go to page 15, so alcohol and cancer specifically. So I thought this was really interesting. So cancer is a leading cause of death in Canada. However, the fact that alcohol is a carcinogen that can cause at least 7 types of cancer is often overlooked and unknown. The most recent available data shows that the use of alcohol causes nearly 7,000 cases of cancer death each year in Canada alone, with most cases being breast or colon cancer, followed by cancers of the rectum, mouth, throat, liver, esophagus, and larynx. According to the Canadian Cancer Society, drinking less alcohol is among the top 10 behaviors to reduce cancer risk. Pretty bold statements there, and I really appreciate this particular guide because it gives you a little bit more strict, shall we say, guidelines. It has a great infographic. Here we go. Drinking less is better. So this is a printout or infographic that they have, but 0 drinks per week is recommended for no risk at all. Low risk, 1 to 2 drinks per week, not per day, per week. 3 to 6 drinks per week, moderate risk. 7 or more standard drinks per week, increased or high risk for developing those cancers or other types of negative outcomes. So this is more aggressive, shall we say, guidelines compared to previous guidelines. I think this is really interesting because it is a carcinogen. It's very damaging to our tissues. So reducing alcohol alone can be a very helpful thing to do. All right, so I am a nutritionist. I can't obviously not talk about diet and nutrition. So my general recommendations for eating really well is protein source at each meal, half your plate covered in vegetables, color. Oh my gosh. All right, so my nutrition recommendations: protein source at each meal, half your plate in colorful plants, whether that's some fruit, some vegetables, a mix, some healthy fats, starches according to your activity level, reducing sugar sweetened beverages, processed foods, high sugar foods, vegetable oils, pastries, candies, processed stuff like that. But we also have to talk about digestion. So we can't really have the best nutrition unless we are working on our digestion as well if there's a problem. So good digestion looks like minimal bloating, chewing our food really well, no heartburn, no GERD, no reflux, reflux, no pain associated, no abdominal pain, no pain with passing bowel movements. At least one bowel movement per day is ideal. Multiple is fine as well. That's obviously dependent on what we're eating and how much, the volume of it, our fiber intake, our hydration, things like that. But also looking at the medical definition of constipation is less than 3 bowel movements per week. Now, there's lots of factors that impact this. It could be, how much we're eating. It could be genetics to an extent. It could be anatomical. There are caveats to that. But for optimal colon health, I think we should be moving waste through on a regular basis. Looking at colon health in general, the risk factors for colorectal cancer, these are the ones that are outlined by cancer.org. Being overweight or obese, our nutrition can help with that. Exercise can help with that. Sleep can help with that. Not being physically active, same thing. We can change those with those factors. Certain diets, so diets really high in red meat, processed meat that is cooked at really high temperatures. And this is because those types of foods have a really high heterocyclic amine content. Those are basically the food is being damaged by the high heat or by the processing. We have a higher content of those, and those specific compounds are carcinogenic. They are mutagenic. There's no defined level that's noted as safe. We can just rank foods as far as what contains the most, what contains the least, things like that. A diet that is low in vitamin D, or if you have a low vitamin D status, that is a risk factor for colon cancer as well. Smoking and the use of alcohol are the other ones. Other risk factors that you cannot change: being older, over the age of 50, significantly increases your risk. History of colorectal cancer or colon polyps, a history of IBD, so things like ulcerative colitis, Crohn's disease, things like that. Family history of colorectal cancer, inherited genes or certain syndromes that can predispose you to developing colon cancer, and then certain populations and ethnicity. So American Indian, Alaska Native, those populations have the highest rates of colorectal cancer, and then also followed by African Americans, men and women. Other factors having type 2 diabetes. Type 2 diabetes also has a lot of those other factors in common. So being overweight, tending towards being less physically active, those dietary factors, those are usually in common as well. Another one is night shift. Working night shift is another risk factor for developing colorectal cancer. Those are the known risk factors. And again, just think back to all those pillars of health that we just talked about: sleep, stress, exercise, activity, walking, eliminating alcohol, the dietary changes that we can make, or sticking towards that generally healthy diet that we talked about: the protein, the vegetables, the fruits, the healthy fats, starches according to our activity level to help us maintain a healthy weight. All of those things can really address a lot of those risk factors for colorectal cancer. We sum all this stuff up. Yes, we want to poop every day, but all of those pillars of health help us do that. If we're hydrated, if we're moving, if we're eating generally good food, if we have fibrous foods on our plate, we're probably going to have a much healthier colon and better overall health because of it. So hopefully that gives you a little insight into the whys, the risk factors. Hopefully you can walk away with a very simple, some simple recommendations to help you prevent your potential risk for developing cancer. If you would like more resources for this, you can go to the parksidenutrition.com website. A couple resources I'll highlight on this website really quick. If you go up to the top here, this is the Habit Kickstarter. This is my group program, and we focus on all of those pillars of health that we just talked about. It is a great resource for building accountability, increasing your general education as far as basics to nutrition, and you can choose if you want to add any one-on-one consults. Plus, you have weekly Zoom calls to check in with the community, make sure that we're on track, go over any challenges, and make sure that you don't go too long without seeing the success that you want to see. So if you are looking for a resource while you are starting your health journey or progressing along your health journey, this is one of the best tools that I can offer. If there's any other questions based on what we talked about today, just reach out through my website. Allie@parksidenutrition.com is my email, and I'd love to answer your questions, but hopefully this is helpful.